Hey, welcome to The Explainer. Today, we're going to break down something super important: nursing ethics. Think of this as your moral compass, the tool you're going to need for your entire career.
I mean, that's really what ethics is all about, right? It's about figuring out what to do in those messy gray areas, when the answer isn't just obvious and you feel like you're being pulled in a million different directions. All right, so here's the game plan for today. We're going to start with the 5 big ethical pillars, then we'll see how they fit into your professional code. We'll look at what happens when these ideas clash, walk through a real-life dilemma, touch on some modern-day issues, and then wrap it all up with a recap to get you ready for any exam.
All right, let's jump right in. We're talking about the 5 core principles here. These are like the non-negotiable foundation of your practice. They're the true north on that moral compass we were talking about.
First up, we've got autonomy. And the easiest way to think about this is that the patient is the captain of their own ship. It's their right to choose. Seriously, even if you, their family, or their doctor thinks it's a bad idea, a competent adult gets the final say about their own body. This idea, it's the absolute bedrock of what we call informed consent. Okay, next up is beneficence. And honestly, this is probably the reason you got into nursing, right? It's that core drive to just do good, to take positive steps to help people. It means always putting your patient's best interests first, even before your own. It's really the heart, the why behind everything we do. So if beneficence is about doing good, then non-maleficence is its twin, the promise to do no harm. Now, this gets tricky, right? Because in healthcare, sometimes treatments do cause harm to get to a better outcome. Just think about chemo side effects. So this principle isn't just never hurt anyone, it's about constantly weighing the risks against the benefits. It's a balancing act. All right, now let's talk about justice. This one kind of zooms us out to the big picture. It's all about fairness, especially when resources are tight. Who gets that last ICU bed? Who's next on the organ transplant list? Justice says those decisions have to be based on one thing and one thing only: clinical need. Not how much money they have, not who they are, none of that matters. And last but not least, we have fidelity. This one sounds simple, but wow, is it powerful. It just means you keep your promises. That's it. If you say you'll be back in 20 minutes with pain meds, you're back in 20 minutes. This is how you build trust. It's the absolute foundation of that nurse-patient relationship, built one kept promise at a time. So check this out. This is where we see how these big kind of abstract ideas actually show up in real life. It's about translating the theory into what you'll actually hear from patients. Autonomy isn't some textbook term. It's a patient looking you in the eye and asking, "Can I refuse this surgery?" And fidelity? That's them asking, "Are you really coming back?" This is where the rubber meets the road, right at the bedside. Okay, so we've got the pillars. Now let's see how they get built into your professional code. The official duties and standards you're held to. Okay, this is a big one. You have to know the difference between responsibility and accountability. Think of it this way. Responsibility is your to-do list. It's the duty to do your tasks. Accountability is what happens after. It's owning the results of what you did. So if you make a mistake, accountability means you step up, you report it, you answer for it. You don't just brush it under the rug. And that leads us right into confidentiality. Look, this is non-negotiable. The rules, like HIPAA, are super strict. It all comes down to a simple need-to-know standard. And please be careful with social media. Even if you don't use a name, posting something like "crazy night in the ER with a rare case" can still get you in massive trouble. People can figure it out. And the consequences? They're no joke. We're talking getting fired and even losing your license. Okay, so here's where it gets really interesting. What happens when these principles, which all sound great on their own, suddenly crash into each other? Like, what if your duty to do good for a patient directly contradicts their right to choose? Well, that's when you find yourself facing one of 2 big ethical problems. And this slide just lays it out perfectly. An ethical dilemma is like a tug of war. You've got right versus right. 2 perfectly good ethical principles are pulling you in opposite directions. But moral distress? That's totally different. That's a roadblock. You know exactly which way you should go, the right path is clear, but something or someone is standing in your way. And you need to know this because moral distress is a massive driver of burnout. The key is to spot it, name it, and then use your resources, talk to your mentor, call the ethics committee to push back on that roadblock. All right, enough theory, let's put this into practice. We're going to take a real-world case and walk through it, step by step, using a framework to figure out what to do.
You know how you have a process for everything in patient care, right? The nursing process? Well, this is the same idea but for ethics. It's a 7-step process that helps you get past that initial gut reaction, that emotional, I have to do something now feeling. It guides you to a much more thoughtful and, frankly, defensible decision.
Okay, so let me introduce you to Miguel. He's 18 years old, just diagnosed with diabetes, and he is not happy about it. You walk into his room and find him munching on a bag of sugary snacks a friend smuggled in. Immediately, your internal uh-oh alarm starts blaring. This is a classic dilemma, right? Your duty to do good and keep him safe, that's beneficence, is slamming right into his right as an adult to make his own choices, even bad ones. That's autonomy.
So the nurse could totally go in there and lecture him, right? But she doesn't. She sees Miguel as just pushing back, saying he doesn't care about his health. And instead of arguing, she pivots and asks this amazing question. It completely changes the dynamic. It stops being about the diabetes and starts being about Miguel, the person.
And here's the key takeaway. The solution wasn't about enforcing the rules. The breakthrough happened because the nurse built a connection. She found out he was into video games, and they just talked about that for a bit. By treating him like a person first and a patient second, she earned his trust. And with that trust, she got his cooperation. That is what we call an ethics of care approach.
You know, medicine is always changing, and as technology and society evolve, we run into brand new ethical challenges. Let's talk about some of the modern minefields you're going to have to navigate, especially when it comes to things like quality of life and that really tough question of medical futility.
This is such a great way to visualize these incredibly hard conversations. Just picture a seesaw. On one side, you stack up all the burdens of a treatment. We're talking pain, financial cost, emotional suffering, everything. On the other side, you put the potential benefits, a chance at a cure, more time with family, a return to independence. And when that burden side is just slammed to the ground, when it so clearly and permanently outweighs any possible benefit, that's when we have to talk about medical futility. And at that point, the ethical thing to do is to shift our focus from trying to cure to providing comfort and care.
Phew, okay, that was a lot. So let's pull it all together. We're going to wrap up with a super high-yield recap of the absolute must-know points, both for your exams and, more importantly, for your actual practice.
Think of this as your cheat sheet. Let's run through it. Autonomy, patient's right to choose, period. Non-maleficence, do no harm. Fidelity, keep your promises. Watch out for moral distress. It's a real cause of burnout. And a huge one, never ever post patient info on social media. When you boil it all down, what's your number one job in all these situations? Be the patient's advocate. So, as we wrap up, I want you to just take a second and think about all this. We've talked about dilemmas like Miguel's, the intense pressure of moral distress, the tough calls and end-of-life care. So my question to you is, after going through this, which one of these ethical challenges do you feel a little more ready to face now in your own practice?